A very good evening, Zimbabwe. This is Studio 7 Live Talk, coming to you live from the Voice of America in Washington. I'm your host, Sithandegile Mhlanga.
And I'm Marvelous Mhlanga Nyahuye, this Thursday, May the 20th, 2021, broadcasting from my home in Washington, D.C. because of the COVID-19 pandemic.
Yes, and today in our Live Talk, the Women's RoundTable segment, we'll be looking at a variety of topics related to COVID-19, seeing that the Ministry of Health is saying the confirmed cases so far in the country are 38.5 thousand, with 36.3 thousand recoveries and more than 1.5 thousand deaths.
Yes, and they've also said that the second phase of the COVID-19 immunization program is actually going on course. According to them, they say over 600,000 people have been vaccinated for COVID-19 in the country at the moment. So we will be taking a look at what is going on in Zimbabwe and also worldwide.
Yes, Marvelous. And we have seen that the Ministry of Health says the COVID-19 variant that's predominantly found in India was detected in Kwekwe, meaning that the virus is now in Zimbabwe.
And also they've instituted some stringent COVID-19 isolating measures that they say when a person is coming from outside Zimbabwe. Now, when they get to Zimbabwe, they must have a COVID-19 certificate of 48 hours instead of 72 that was there before. And also, and you should, when you get to Zimbabwe, test negative. And if you are found to be positive, or before you have a certificate saying that you are negative, you will be quarantined at your own cost, and the testing will be done at your own cost. So those are some of the changes that they are instituting.
Yes, Marvin, the government has said that specifically people traveling from India or transitioning, they will have to be subjected to mandatory quarantine at the designated quarantine centers, also at their own expense.
Yes, and some people, we had an earlier discussion yesterday, some of the experts were actually saying the government also needs to cover the issue of those that are coming into the country who have already received both their doses of COVID-19, because we've seen some of the laws that were passed here to fight COVID-19 being lifted in some places when people now have what they call herd immunity, or if they've had their 2 jabs. So they wanted the government to address that issue. So it would be interesting to see what stance the government would take. But I think the statement that we saw coming from the health minister, Mr. Chiwenga, saying that they are aware that there is the Indian variant in the country, people welcome that, to say at least the government is taking, informing the public of what is going on.
Yes, Marvelous. So that's very interesting, that and other projects that the women are doing that are related to COVID-19. We'll be discussing all those in this show. Yebo-ke kulabo abasanda ukusixhuma lamhlanje lapha emsakazweni we-Studio 7. Leyi-ke yilo uhlelo lwethu olwe-Women's RoundTable, lapho-ke esilethulela indaba ezehlukeneyo, ikakhulu eziphathelane labesifazana. Sikhangela ukuthi sikhuluma nje siphakathi kobhubhane lwe-COVID-19 ngesikhathi uhulumende ugatsha lwezempilakahle lusithi sikhuluma nje abantu asebahlaselwa yileli gciwane selokhu laqhamukayo ngomnyaka odluleyo ngomvimbitho sebesedlula ngathi sebefika phose inkulungwane ezingamachumi amane, 38.5 thousand. So sele nje inkulungwane elengxenye ukuthi kufike kunkulungwane ezingamakhulu amane, 40,000. Njalo siyabona ukuthi ayisikho ukuthi yibo bonke laba abantu lokho benjalo, abanye sebasila. Ngakho kulalokho kuthiwa ama-recoveries, labo asebalulamayo ke bangu 36,000 bayedlula lelo nani, 36.3 thousand, amachumi amathathu enkulungwane lesithupha. Njalo selabulala abayinkulungwane lengxenye yalo 1.5 selokhu laqhamukayo leli gciwane. Siyabona njalo ukuthi kulohlelo ke lokuthi abantu bemukele umjovo we-COVID-19, njalo labo ke sebesedlula inkulungwane ezingamakhulu ayisithupha, 600,000. ngoba sekudlula i6.5. Sikhangela ukuthi abanye mhlawumbe bahlatshwe kanye bamelele ukuthi bayihlaba kwesibili. Kodwa esikuzwayo lapha okungani akuthabisi kakhulu yilokhu ukuthi lanxa nje amanani engane ayehla kodwa ugatsha lwezempilakahle niphatha intambo obona ngezempilakahle umnumzana Constantino Chiwenga uthi ukhakha lwe-COVID-19 lolo lutholakala kwele India solukhona eZimbabwe ukhona ekhwekhwe ofumanwe elalo. Yena phela kuthiwa i-variant leyo engajayelekanga ese-India ye-B1617 sikhona-ke kwele Zimbabwe njalo sikhumbule ukuthi uhulumende usethe abantu abavela kwamanye amazwe kuyamela beqale behlolwe njalo behlale bodwa kuma-quarantine centers lakuma-isolation centers bezibhadalela bona indleko lezo ukuze kubonakale ukuthi abala COVID-19 njalo abasoze bayisabalalise elizweni. Yikho-ke sabe sikucubungula-ke lokhu kathesi njalo sizezwa-ke silomhlonitshwa wethu sizakhuluma naye lapha ovela kunhlanganiso ye-Women of Zimbabwe Rise. Bayenza-ke ucwaningo ku-Water on the Heads of Women. Sikhangela ukuthi balenzeke ngesikhathi senesi se-COVID-19 langokunye nje okuningi okuphathelane lalolu hlelo. Uzabe-ke esicubungulela lo mbiko ukuthi kuyini abakufumanayo, kuyini okwenzakalayo. Yebo-ke, marvelous.
Aiwa, kunavo vachangobva kupinda muchirongwa chedu tinokuchingamidzai nhasi tiri kuenderera mberi tichikurukura pamusoro pedenda rechirwere cheCovid-19 tichitarisa zvakare zvakawanda zviri kuitika munyika panyaya yedenda irori. Tichange tiine munyarekani wedu ari pano watichange tiri kukurukura navo avo vakawanikwawo vachibayiwa nhomba yeCovid-19 uye zvakare vari kurarama nedenda reHIV. Saka vachange vachitibatisa ipo pano kuti zvakamira sei uyezve zvii zvavanokurudzirawo vamwe vanhu kuti vaite vakatarisana nedenda irori. Tinotarisa zvakare kuti bazi rezveutano riri kutaura iro kuti pane vanhu vanodaudzira 600,000 vawanikwa vachibayiwa nhomba yeCovid-19 munyika. Vachitaura ivo kuti pane vanhu vakabatwa neCovid-19 vakatadza kukunda chirwere ichi vanodaudzira 1.5 uyezve vachitaura ivo kuti pari zvino pane chirwere chiya chiri kuIndia, variant yekuIndia vari kuti yawanikwa mukwekwe uyezve vari kukurudzira kuti vanhu nyanya vanenge vachibva kunzvimbo dzakadai seIndia pavanopinda munyika vabva vapinzwa muquarantine. Muquarantine umu vanhu ava vanenge vari kuzvibhadharira vega kana vachida kuitwa maCovid-19 test vari kuzenge vachibhadhara vega kubva mupoketi yavo uyezve zvakataurwa nezuro kuti vamwewo vashanyi vanenge vachibva kunze kwenyika vachishanya muZimbabwe vachafanira kunge zvakare vachiwanikwa vachizvibhadharira kana vachinge vachiiswa muisolation nekuti vari kuti ivo vari kuda kuti denda iri risawanikwe richipararira. Vakataura zvakare bazi rezveutano vachitaura ivo vachitaura kuna mai mutsvangwa ndo vatakaona vachitaura ivo kuti ivo nekabhineti yese vanga vawirirana kuti zvakakosha kuti vachapinda munyika pari zvino kana usina certificate iya yekuti uri COVID-19 negative yatorwa 48 hours unofanira kuwanikwa uchizvitesta nemari yako wega. Kana uchipinda muisolation wobva wapinda zvakare nemari yako wega. Asi vamwe vanga vari kuda kubvunzawo kuti ko vaye vanenge vari kubva kunyika kwavakawanikwa vachibayiwa nhomba dzeCovid-19 dzese dziri mbiri kana imwe chete yekuzvidzivirira zvichafamba sei? Saka ndo zvimwe zvatakatarisa takamirira kuti tione kuti zvichafamba sei. Asi pari zvino regai tibva tachingamidza munyarekani wedu wokutanga amai Tendai Westerhof vari pano. Regai tinzwe kubva kwavari kuti ivo zvakamira sei panyaya iyi yedenda reCovid-19 kwavari kuZimbabwe. Tinokuchingamidzai nemufaro.
Tinotenda manheru, mangwanani, masikati kune vanhu vese vakateerera. Ndiri kutaura ndiri kuKadoma. Chirwere cheCovid ichi tese tiri kupuhwa information yakakwana iri kubuda pazvivhitivhiti, imwe iri kubuda mumaredhiyo nepamativi nemumapepanhau kuti vanhu vari kukurudzirwa kuti vabayiwe nhomba yeCovid-19. ini pandiri pano ndakatobayiwa nhomba iyi ndane mwedzi 2 ndabayiwa nhomba yokutanga nenhomba yechipiri. Ndinonzwa zvakanaka nokuti zvinoita kuti ndidzivirirwe kubva kuCovid-19 uye kuti kana ndikazobata utachiona hweCovid handizonyanyisi kurwara zvakanyanyisa zvakanyanya zvinofanana nemunhu uya anenge asina kubayiwa nhomba iyi. Uye kana munhu wabayiwa hauzokwanisi kuparadzira COVID-19 kune vamwe munharaunda kana vanhu vaunogara navo. Saka tinokurudzira kuti vanhu vese vaende vanobayiwa. Nhomba idzi dziri kupuhwa pachena nehurumende. Hazvisina basa kuti unogara kupi, mazera ese evanhu, kunyanya vanhu vese vari above 18 years. Vari kubayiwa nhomba iyi, vanhu vakwegura vari kukurudzirwa kubayiwa nhomba iyi. Vanhu vanorarama noutachiona hweHIV vari kukurudzirwa kubayirwa nhomba iyi. Nevanhu vane mamwe atinoti ma-underlying conditions vari kukurudzirwa kubayiwa nhomba iyi. Saka ini ndinoti vanhu havafani kutya, hanje ino uwandu hwedu. Pese pane nhomba iyi pairi kubayiwa, toona kuti tabayiwa isu nevadikani vedu vatinogara navo munharaunda kuitira kuti
Can you just tell us about your experience of the COVID-19 vaccine? Currently, there are a lot of people who've been asking questions, especially women living with certain conditions. What's your take and how was the experience for you?
Okay, I'm living with HIV for the last 18 years or so. And I'm among the first people who were really vaccinated with this condition of HIV. And when I was vaccinated, I really felt good. And I encouraged my peers, women living with HIV, and all other people who are living with HIV to get the COVID jab. It's good for our health because we are also vulnerable to the COVID-19 virus like anyone else. So the fact that one is an underlying condition like being HIV positive or diabetes, etc., it's irrelevant. Apparently, people with those underlying conditions are actually encouraged to be vaccinated for COVID-19. Information is being disseminated on radio, on TV, in all our native languages, and it's being disseminated even in the newspapers. People are reading, and I think we do have road shows as well that are happening to continue to ensure that COVID-19 information and the information around vaccines reaches to the very people who need it, and that everyone is aware of the importance of being vaccinated for COVID-19. We need to get more people to take up this vaccine so that as a country we become safe from COVID. And the only prevention of COVID-19 right now, which is known, is to get this vaccination. Because if you are vaccinated when you catch the coronavirus, your chances of getting terminally ill are very slim as compared to someone else who is not vaccinated. Therefore, people must not fear. It's important to protect yourself. It's important to protect me. It's important to protect everyone. And everyone is safe until everyone is vaccinated. So yes, we welcome this program of vaccination, and we just hope that people will come out in their numbers and go to these centers where the vaccination is being offered. It's for free. You don't buy anything. And the process is very, very simple. You simply go with your ID, they record you, you get vaccinated, you get your certificate. So this is the chance of a lifetime, and anyone who has access to these vaccines should get them. And we are advocating that we should have more vaccines so that every adult who needs the vaccine should have access to it. Thank you.
Thank you very much while I wait for Star to come back. Star, over to you.
Yebo, siyabonga marvelous besizwa ke lapho ke omnye umhlonishwa wethu othi yena uphila legcikwane lengculazi le-HIV njalo ukhuthaza abantu ukuthi bayehlaba umuthi wokuvikela leli gcikwane nomkhuhlane we-COVID-19 ama-vaccinations kasaqhubeka elizweni. Sesiyamukela njalo-ke umhlonitshwa wethu owesibili unkosazana Magodo Ngamahlangu owenhlanganiso ye-Women of Zimbabwe Arise iwoza. Siyakwamukela-ke kuhlelo.
Ngiyabonga kakhulukazi ukuba lami ngaleli langa.
Yebo-ke, as we can see, you recently launched a report which says water on the heads of women, and it was done during this COVID-19 pandemic. If you can briefly summarize for us exactly why you did this research and what exactly, in summary, you came up with.
We basically did this research because we noticed that as much as we're asking people to social distance and stay indoors, in Bulawayo we had water crisis, so women were the ones having that burden, where the water was not coming from their tap, so they had to go out and in search of water. It's not a question of going to fetch it, you have to look for it, and then there's pushing, there's shoving, there's long queues, there's all sorts of things to access that water. And then women were saying they are not even able to practice hygienic tendencies at home because we don't have water. So we realized that most alternative sources that were being used by people, by households, were boreholes, unauthorized source of waters where people will just go there and get water wherever they could get it. And the challenges that came with that, especially for women, when they're trying to have their hygienic needs, cooking, their home care, basic duties, it was a challenge for them.
Yes, and how is this linked to the COVID-19 pandemic, your research and your findings?
It's very much linked because when you're talking about COVID regulations, you're talking about regular washing of hands. You cannot talk of a sanitizer in Zimbabwe because people are very poor, the economic hardships that people are facing. So they will have to have water, and that water was not there. And the water, even, let's take COVID away, the pandemic away, it is very unhygienic for people to recycle water. You find that some households, they're saying that for them to eat, to prepare a meal, they will prepare the meal, wash their hands in one basin, and then reuse that water that they've used to wash their hands to rinse the place, and then those places are used. Already we are talking about a health hazard. And in terms of COVID, that's how the virus spreads. And also the regular cleaning of the houses, the use of the toilets, all those things, the facilities. So it became a challenge for women to observe social distances and also to try it to be in lockdown, especially during level 5, because they spend most of the time they spend outdoors looking for water, in search of water.
Yes, and you also mentioned some hygienic challenges that face women, maybe that are exclusive to women and children. Which ones are those which you discovered in your...
It was very sad and really traumatizing for us as we're analyzing these questionnaires, where we realized that women are resorting to unhealthy tendencies, where, especially during the monthly periods, they will just have to use whatever they use, and then they dry it in the sun and they reuse it. And others came up with a method of where they introduced the contraceptive pills. You know, they will take the white line and then skip the brown line, even for their little girls, so that they cannot go on monthly periods. Those are the things that we realize that they are really tormenting women, that they have to take such measures that can even affect the fertility or the long health of their children, of their girls, of their young girls. So the young girls were introduced to this contraceptive pills, not for the purpose of, so that they can skip their monthly period. And the other thing we noticed, which is very unhygienic, that the report came up with, is that the use of tins or plastic bags and then they will use that, and then in the evening they'll go and throw that in the bush. The health hazard there again comes into play. And we also have challenges whereby women as mothers caring for young children with weak bladders, they will urinate in their blankets. They will have to dry those blankets without washing them. And then the bad smell, the stench of that urine is all over the house. And there was a lot of domestic violence also that was experienced by women, as the alternative sources of water, like the kiosks, the boreholes, are manned by men. And then most cases, women, even men, say the women are asked for sexual favors to access water, which is very unfortunate.
Yeah, kuyezwakala. Ungasifinqela njalo ngolimi lesindebele ukuthi kuyini kahle kahle elakufumanayo ucwaningo lweni lolo oluphathelane.
Ucwaningo olama ukuthi amanzi athwala ngoma emakhanda, because abe yase technology sasenza lithona amanzi kasaphuma empompini, and kwakuyisikhathi se-COVID u-level 5 ngoba kuthe sihlale ezindlini sonkeneni. Okusizakala ukuthi khona omama amanzi ayengakaphumi emathepini for almost a year, abanye vele lakathi sebenga ngaphona. So abantu babe sesuka bayidinga amanzi. Emanzini lapho ayidingwa ayengayikukha, ngoba ekhaya sithi siyakukha amanzi, lapho kubulawayo ayadingwa amanzi. Ekwadingeni kwabo esibhoraneni, emthonjeni, kuma-kioski, kuyaliwa, kuyafuqana, akula kuqhelelana. Imikhuhlane ye-COVID ithume siqhelelana. Ezindlini kulokubalelana kwamanzi, amanzi vele ayashoda, labe le 20 liters, abanye bayithi khona amanzi lawo nxa semancane kangako, ukuze bapheke badle, bazapheka, bageze izandla. Amanzi lana bageze ngawo izandla, bazawagcina, yibo bazageza ngawo umganu, lembiza, izitsha zonke abapheke ngazo, baphinde bazisebenzise futhi. So singananzela ngesikhathi segcikwane leli COVID, kuyamemethekisa umkhuhlane lokho, even lanxa ungela gcikwane vela sompilo singaphila ngayo. Sesinanzela futhi khona kompani ukuthi khona ekukhena amanzi lapha, izakhi indawo eziningi lezi athola khona amanzi, ama-boreholes, ama-kioski, ngobaba abazikhangeleyo. And abantu bebekhala ngokuthi omama baforcwa ukuze bethine besemacansini ukuze bathole lawo manzi, beyenza ukuthi ungahamba ecansini lami uyahlala uthola amanzi. Kuyangikhala sokusiba obaba labo besekwazi kwenzakala njalo, sokusiba lidlakela endlini solokuthaya. Sesinanzela omama vele bona ngomdabuko wabo balesikhathi sokuthi khona baya emfuleni inyanga zonke. Omama bakunanzelela ukuthi bethwala nzima ukuthi amade bakusebenzisa into zabo zokusebenzisa ade kumele beziwathi, besengasaziwathi besengokuchaya elangeni njalo zome uphinde uzisebenzise. Abanye besinanzela ukuthi khona babe lamaqhinga ukuthi no, into le siyenzayo ukuthi sisebenzise amaphedi singawatshanga akuhambi kahle. Baseqasha ukuthi bathathe amaphilisi lawo ukuthi ungazithwali, basebenzisa nathi iline amhlophe kuphela, bayeqelana imline oyi-brown, banika lengane zabo ezincane ezingamelanga ukuthi ngazi yawasebenzisa. Siyananzela ukuthi khona lokhu kwenza njalo kwezempilakahle awusuzohambele kuhle abantwana, sikwazi kuzabaphatha njani, ngaphazamisa njani ekuzithwale, ukuthi nxa sifuna ukuthi bazithwale mbe vele umzimba wabo uwamukela njani nala maphilisi. So umama bebebuya lamaqhinga nalapho. Sesinanzela futhi ukuthi nxa besiya ngaphandle itoilet bebesebenzisa lokho ukuthi bayasebenzisa bengaflash, abanye babona ukuthi akulunganga umntwana zezihlale, bese bethetha nje futhi bayanyela emagabheni kumbe emaplastini, ntambama ayekutula emagangeni. So khongena kwenza isigaba sethu singahlanzeki, le mkhuhlane kuyasi-expose futhi.
Yebo-ke kuyezwakala, uzwakala sibili kushubile. Sizaphinda futhi siqhubeke lawe sizwe ezinye futhi impawu zokudingisisa kwenu lokuthi kuyini elifuna ukuyenza ngakho. Sesiqhubekela phambili-ke njalo ngohlelo lwethu. Bengubuzile-ke Nkosazana Mahlangu ukuthi kukhona yini elikufumeneyo ekudingisiseni kwenu kulokho elikuzwe kukhulunywa ngunkosikazi Westerhoff.
Yeah, khona singananzela ukuthi khona ukuthi uswelakala kwamanzi khona lokho lokuthi kule COVID labantu abaphila ngamaphilisi kakhulukazi. Uthe khuluma laphana ngokuthi khona abantu ba-HIV positive, abanye omama abaningi babesithi nxa besemaphilisini khonapho bethi bedefaulta kumaphilisi abo ngoba ngeke uwathathe wani ungadlanga kumbe ungela manzi. Esikhathini vele isikhathi sitshaya kakhulukazi uselayinini yamanzi udinga lawo manzi. so konkhana kuba affectile futhi omama abaningi and nxa sinanzelela kulabanye abavele sebekhulile kumbe abaphila lokugoga laba bantu bebesehluleka ukuthi bayethola lawo manzi ngoba alayinelo kuyafuqwana athola ngalamandla so bekumele badinge imali ukuthi baqhatshe abantwana kumbe abanye abantu abangabathengela abangabalayinela babanike lawo manzi uyathola ukuthi khona iScania kumbe ibhakede lamanzi 20 liters kumbe 40 liters uyabhadala $1 ukuthi $1 ukuthi uthole lo muntu oyakutholela amanzi so uswela uhlupho lamanzi lokuthi vele kule COVID khona ngokwakho kuvele kwaphazamisa kakhulukazi laba abaphila lobugoga labaphila ngamaphilisi ngoba abanye bebesithi kwenilanga bake badlala bengadlanga ukudla belakho beswele wona amanzi ukuthi bapheke konkana ngeke uthathe iphilisi lakho ungadlanga so kuyananzela kuyaphazamisa ezempilakahle zibonakala.
Yes, interesting that you also found in your report that there is some correlation between what Tendai Westerhoff was also saying on the people living with HIV. Right, coming back to your report, before we get to the recommendations, did you find out if the stakeholders, the local authorities and ZINWA or others are really trying their best to intervene?
They are as for the city council, we can say they are trying their best, but their best isn't enough because it's not adequate. As you will notice that the same water sources that have been supplying Bulawayo have remained the same since I think we attained independence. We have just if you have new dams, there are not that many, and the Shangane water dam project is not really moving that fast, and the quantity of volumes that is coming in is not adequate. So we have a challenge where they've come up with other alternatives like the water kiosks, the water bowsers, which further burden women and the rights holders, the residents, where they have to queue. And as for the water bowsers, at times it's very the delivery of the water is very unreliable. It's not a regular time. They say they will tell you on Tuesday, but at times it doesn't come, or people will queue from morning until evening, and they have got back home. So the water challenges in Bulawayo, we need a long-term solution rather than the short-term measures of water kiosks and water bowsers. It doesn't cut it because it's a non-problem. That means maybe we need the central government that is responsible for supplying raw water to come up with more water dams to supply raw water to Bulawayo.
Yes, and what other recommendations did you come up with, and to whom did you address them to, and did you actually hand them over to say, this is what we found, can this be done?
Yes, as we were doing the research in the communities, where when we're finding issues from the communities, we're also engaging the Bulawayo City Council and the central government that deals with water. We're highlighting all these problems, and they were telling us we've done this, but we're saying, look, your interventions are falling short because you know this is a crisis. It's not even enough. But we're talking about the Zamboza Water Project that if we could have that green belt and even the Waishangani Dam, if it can be utilized and move fast, people can start having water. But you are seeing that at times there is too much talk and then not much action. Because the quantities of the challenge is the raw water that is flowing into the city council. Because the Bulawayo City Council is only responsible for the potable water into the taps, not the raw water.
Yebo siyabonga ungakufaka ke ngolimi lesintu ukuthi kuyini esela esingathi lifuna ukuthi kwenziwe njalo la kunika ziphi iziphathamandla.
Iziphathamandla ze city council yako Bulawayo besivele sisebenzisana labo esikuthola sibuze sibabuza ukuthi kathi ama water kiosk ahamba njani konke lokhu hamba njani abantu bayaswela amanzi basebesitshela basichasela ukuthi hayi thina vele ukuthi amanzi lawo thina umlando wethu ukuthi sinika amanzi ezimpompini amanzi source yamanzi singathi raw water lapha suka khona umlando we-central government. So ukukhulumisana kwethu central government konke le city council yako Bulawayo sikubonile ukuthi imizamo yabo kayenele ngoba ngananzela kakhulu esikhangela uhlangothi kahulumende kulokudonsa kulokudonda kulokwenza akula sifiso sokuthi udaba lwamanzi lokwabulawayo liphele iminyaka yonke nje kuyakhulunywa ukuthi iproject eShangani ngoba sizaba locwaningo ukuthi sizafika khona ngala ukuthi ngapha babe report abathi senzile lokhu lalokhu kodwa usiyafika on the ground uthola ukuthi akwenziwanga so kulomacatshelana obakhona okwenza lokho kubophe uCity Council wakobulawayo ukuthi yena angasinike amanzi eneleyo ngoba umlando kaCity Council ukuthola athola amanzi water awahlambulule awanike izakhamizi zakabulawayo kodwa kuyabehlula lokho ngoba bavele bawamukela emalutshwane okukho sokubangela khona lokuthi singatholi amanzi ahlanzekileyo so esikurecommenda kakhulukazi ukuthi udaba lwamanzi balithathe lube serious njalo sibuyeka kakhulu ngananzela sikhuluma ngokuthi human rights based approach ukuthi uhulumende kumele abekwazi ulomlando ukuthi asinike amanzi ngoba amanzi alilungelo singakhala constitution eZimbabwe section 77 it's not like they are doing us a favor umlando wabo ukuthi basinike lawo amanzi so siyafuna lawo amanzi abe khona indlela ezingayenza abe khona ubulawo lekhula amadamu kumbe izakhiwo amasources amanzi asupply ubulawayo la kumele ngaqheliswa asikhulumene siqede iZambezi water project esi100 years sikhulumene ngeShangani ngekwayiShangani dam aquifer elokhu isenzwa ngama percentage ngaphandle kwalanzela amanzi siwathola evela khona ngalo malutshwane kakhulukazi ukuthi nxa but kule amanzi avele khona wena ukuthi nxa singa pumping pressure imali ngaba khona le system ngaba khona engezwe udubo lamanzi kobulawayo lengaphose liphela.
Yebo ke sibonge kakhulu unkosazana Magodo ngamahlangu ke lapho besichasisela ke ngocwaningo abalenzayo ukuziphathelane lamanzi. Yebo ke sizabuyela kuye njalo sicubungula okuningi ke okunye siza kukhangela ngalolu cwaningo kanye la kutshoyo ngomkhuhlane we-COVID-19. Over to you, Marvelous.
Thank you so much. Pamusoro pemamiriro akaita nyaya yekunetsa kwemvura vanotiwo pane study yavakaita uyezve vari kuona kuti pane nyaya yekunetsa kwemvura munzvimbo yebulawayo nedzimwe nharaunda dziri pedo neipapo. Tombodzokera kwamuri amai Tendai Westerhof. Saka tomboti kune vamwewo vakateerera pari zvino vari kuwanikwawo vari kuraramawo nedenda reHIV AIDS panyaya yenhomba yeCovid-19 mungavaudza kuti chii?
Nyaya ndinoda kungokurudzira vamwe vangu vanorarama tinobayiwa ngatiudze dzimwe shamwari dzedu tiende tinobayiwa ngatiudze mhuri dzedu tiende tinobayiwa. Nhomba iyi yakanakira munhu wese ndokuti tipedze kupararira kwedenda reCovid uye pamusoro pazvo tine mamwe matanho anotaurwa atinofanirwa kutora nyaya yekugeza maoko kusanitizer nyaya yesocial distancing yekusangomira padyo nepadyo nyaya yekuramba takapfeka maface mask edu nenyaya yekungoita unnecessary movement nenyaya yemagatherings yokurega kuita magatherings ndokuti tipedze kupararira kwechirwere ichi cheCovid-19. Hatizivi kuti chichagara nesu kwenguva yakadii kasi ndiri kufara nezviri kuitika munyika kuti mavaccines ako, nhomba iriko, uye vanhu vari kubatwa nechirwere ichi vashoma, vari kuramba vachiderera, kuratidza kuti programu yehurumende iyi iri kushanda zvakanaka. Saka umwe noumwe munhu zvinenge zvakanaka kuti afambise mashoko ekuti vanhu vatore nhomba nokutevedzera maguidelines atakapuwa senyika anoita kuti tidzivirire COVID. Sezvandambotaura ndakuadzokorodza futi, kugeza maoko kwatinoti hand sanitizing, kupfeka mask, kusangoungana panzvimbo zvisina panzvimbo makawandisa, kunhamo kana mamitingi mucommunity kana pane dzimwe nzvimbo anenge aine vanhu vakawanda haatenderwi. Ngatiite mamitingi edu nezvakataurwa kuti nhamba dzevanhu 30 to 50, uye tichiita social distancing, nyaya yokusangoungana. Saka tikatora matanho akadaro iwayo tinopedza COVID. Uye munhu kana asuspecta kuti ane COVID, ngaakasire kuenda kunoonekwa kuchipatara nokuzvikasira kuzvisudurudza pane vamwe, kuzviita self quarantine, ndokuti chirwere ichi chisarambe chichipararira. Saka ndinoti nhomba iyi yakanaka, handei tinobayiwa, ngatikurudzirane kuti tinobayiwa nhomba iyi, ndiko kuti tipedze dambudziko iri reCovid-19.
Maybe if you can say the same in English, that for someone listening out there, especially women and young girls, and they may be living with HIV, what's your, like, what would you tell them in regards to this COVID-19 vaccine?
Yes, I would say to them that we are all vulnerable like any other people. The fact that we also have an underlying condition makes us even more vulnerable. Therefore, we encourage each other, encourage my peers to go for the COVID jab, to be vaccinated for COVID-19. And the vaccination alone should also be complemented with following the guidelines that we were educated on. That is hand sanitizing, washing of hands, wearing of face masks, wearing our face mask properly. Sometimes you find a person wearing a face mask, but the nose is not covered. Yes. So we need to wear our face mask properly and to practice social distancing and avoiding crowded places and avoiding unnecessary movement. And those who need to be vaccinated should get the vaccine. That is the only way we can beat COVID-19. We don't know for how long it's going to be amongst us. But I'm so happy with the progress that the country is making. We are hearing now that the cases of new cases of COVID-19 are declining, and even critical cases of people dying from COVID-19 are also declining. We can go for days without any reported deaths, which means the program for the government is working well to protect its citizens against COVID-19. So I encourage women living with HIV, people living with HIV, to take the jab and to encourage their peers to also take the jab. That's the only way we can prevent the further spread of this disease, avoiding crowded places, avoiding unnecessary movement. And I encourage us to work remotely. In our organization, Pan-African Positive Women's Coalition, we actually closed our office temporarily until we are so sure of the COVID-19 situation, because we don't have personal protective equipment, and our office is right in the community. So we just took.
We are hearing there from Tendai Westerhoff. She was actually on the phone in Kadoma, where she has been telling us about some of the issues that they are facing as an organization. And she was actually saying they are encouraging their workers to work remotely. But also, maybe, Star, before I hand over to you, I spoke to a lady friend of mine who came from here and traveled to Zimbabwe to ask about these COVID-19 regulations that the government has just instituted. I asked her exactly what she went through after leaving America to get to Zimbabwe. So here's what she had to say.
Kana munhu achinge achikwira ndege achibva kuAmerica, before atombopinda mundege macho vanotokuvhunza COVID-19 certificate yako kuti tipe certificate yako before you board the plane. Kana usina certificate iyoyo uchikwira ndege yekuuya kuno kuZimbabwe haukwanise kukwira ndege. Uchisvikawo muno muZimbabwe vanosvikokuvhunza zvakare kuti tiri kuda certificate. Munotomira mulaini muchilenda, masvika momira mulaini movapa macertificate. Kana usina certificate yeCovid unoenda unokwarantainwa wobva wanzi utestwe, asi izvi unozviita at your own expense. Government haisi kuita matest emahara. Vazhinji vari kutesta kunoku, vari kuZimbabwe vanotesta $60, ende inofanira kunge iri PCR test yaunofanira kuitwa. Iya inonzi inofanira kubuda results at least 48 hours usati wakwira ndege. Zve72 hours zviya hazvichabvumwa. Kwakunzi 48 hours usati wakwira ndege unofanira kunge uine certificate yako yeCovid inenge ichiratidza kuti hauna COVID, unenge uri COVID-19 negative. Mamwewo matest ndakazonzwa kuchinzi kana uchinge uchienda kune dzimwe nyika dzakaita sana Netherlands, pane imwe test yavanoita yekudrowa blood, iyoyo yekutarisa maantibodies zvakare. Ndo imwe test iri kuitwa iyoyo kuti kunyange uine COVID-19 certificate yako, asi kana uchinge uchienda kuNetherlands vanoda test iyoyo.
So we're hearing there from Gladys Jadagu, who's actually a Zimbabwean who's based here in the United States, but she visited home and she's actually still in Zimbabwe. So she was explaining that when she got to Zimbabwe, she was required to have a certificate which was 48 hours valid, not 72 as before. And she said, if it's not 48 hours, then you need to have a PCR test, which is at your own expense. And that test takes 48 hours to also come out. So you have to now be isolated at your own expense. So she was just explaining what she went through and what we're seeing also the government saying they are going to be doing as of now until I'm not sure at what time to enable to make sure that the people in the country are protected. We saw Canada are doing the same, but I think in Canada they were literally preventing people from getting in and bringing in the COVID-19, the different variants into Canada. So they literally closed down the country.
Yebo ke ngabona kubalulekile ngempela lokho imininingwane okumele abantu beyilandile nxa bengena elizweni bevela kwamanye amazwe, indlela uhulumende ayabona ngayo ukuthi abaphatheli ilizwe igcikwane leCovid-19. Ngakho ke kulemizamo ke eminingi yokuthi umuntu ahlolwe ayenze konke nje okuningi. Sesibuya njalo kuwe Nkosazana Magodo Ngamahlangu. In your report, besides the water issue, did you come across any other, very apparent problems that people are facing concerning COVID-19, whether they are linked to water or not?
Yeah, iCovid yona vele ithe yabolelwe leZimbabwe, uhulumende wamane nje wamemezela ukuthi selihlale ezindlini. Awuzange ube lemizamo yokuthi khona abantu iningi leZimbabwe bazisebenza, bathengisa, bahamba lapha laphana, wathahlala nezindlini. Akula muntu okwacabangela ukuthi khona uhulumende akazange asicabangele ukuthi khona kambe laba abantu nje babephila ngokuzisebenza bazaphila ngani. So uthola ukuthi abantu bayafa ngezindlala ezindlini, abalamanzi, abalakudla. Sasinanzela futhi ukuvala kwemingcele khona lokho usizo belivela ku diaspora, sikade ama diaspora dubithesis ebengasafinyeleli. So abantu abanye vele bebephila ngokuthi abalemkhuhlane ama chronic illnesses ukuthi bahlala bamasabaphilisini, imali yabo ukuthi bathenga wamaphilisi lapha eZimbabwe athenga ngeforex ngerand kumbe ngeUS kumbe ngepula. So ukuthi okuvala kwemingcele lapha na uthola ukuthi khona imali lezi kasabuyi, abantu baqasha ukuthi bawaswele amaphilisi lawo ngoba imali bengasela ukuthi bathenga. Sisinanzela futhi khona lapho ukudla, ushoda kokudla, ushoda kwamaphilisi, konke nje lokuthi nxa abantu befuna ukuya esibhedlela bengasafinyeleli ukuthi bahambe esibhedlela ngoba i-transport yona ngayo isiba le problem. Le ncwadi zokuthi aze zidingakala zenzani ukuthi wena ufune ukuya esibhedlela ngoba kulabanye abantu ababathayo sibili bethola amabhuku nalawa ibhuku lakho lesibhedlela umsotsha wathi amfundanga mina ngikwazi ukubala wabatshaya abantu ababesiyabe esibhedlela. So ngezinye izindlela ezithi ukwephulwa kwamalungelo oluntu luba khona lisetshenziswa i-COVID. Uthola abantu nxa ungela ncwadi kulokuthi uphendiswe uhanjiswe endlini uyaqala utshaye kumbe uqala uhlaliswe uhlala khona khona ngokwakho libuthaniswa aliqhelelenanga umkhuhlane we-COVID uba wesi. Esikhathini balilode ezimoteni bahanjiswe bo-central khona ngale ngobuningi babo. So kulokuthelelana ko-COVID kakhulu. Kodwa sesinanzela khona ukuthi nxa sikhuluma nge-COVID sikhuluma ngokuthi abantu kumele bahlale begeza. Kathesi sikhuluma amanzi bengaphumi ezimpompini. Kodwa amabhili alokhu ebuya abantu babhadalelana nalaba abantu. Yikho okunye okungani kuyahlupha khona ukuthi abantu basesikweletu ezinkulu kakhulukazi. I-City Council yabo abantu bayasikweleta kodwa ekhohla abantu amanzi la abawasebenzanga. Sesinanzela futhi okunye ukuthi wona i-City Council bethi nxa eletha amanzi lapha kade kuya khona after 14 days or 18 days. Bebewalethe ebusuku ngabo-12. Aso sikhathi esilungele umama sinaleso ukuthi ngaphuma phandle ngempompini. So amanzi ephuma abanye betshaya ngotsosa abanye bebedlengula besenza zonke izinto ezinye. Into ezinye ezingathi u-City Council kumele bazinanzele urhulumente ukuthi nxa sikhuluma nge-COVID sikhuluma nge-lockdown impilo zabantu ziba sengozini bona i-service yabo abayinikayo bayinika abantu ngasiphi isikhathi njani.
Yes, so ungangezelela njalo ukuthi mhlawumbe kukhona ezinye impawu esingazicubungalanga ezikhona kucwaningo lweni singabe sizitshiyile. Kuyini okunye okuseleyo ongathanda ukukungezelela?
Okukhona ukuthi khona singananzelela kobulawayo ukuthi abantu abaningi uswelakala kwamanzi kwenze abantu bahamba bangena iganga. Besikha amanzi ade engalunganga besikha esikhathini kulendawo njenge-Cotterpark kuliwa amaqhaphozi amanzi nalana yodwa esetshenziswa okungangokuthi kukhona kuya-expose abantu kweminye imikhuhlane enjengabo cholera njengabo typhoid o-diarrhea abantu besebegula ngazo zona izindlela. So udaba lwamanzi so into esingathi khona ingaswelakala njalo kuqakathekile abantu bebelaya. Sinesisanzela lezikolweni lapha kuthiwa ukuvula kwezikolo sikhuluma nje ngathi sikubulawayo abantwana balokhu behamba lamanzi esikolo ukuthi bayinatha. Kwezinye isikolo bayalisa abantwana ukuthi basebenzise izambuzi esikolo ngoba amanzi okuthiwa flash bengelawo. So into ezihlukumezayo zonezi ezithola ukuthi amanzi vele wona ngawali COVID konke akula ma-sanitizer akula manzi pho abantu baphila ngomusa kaNkulunkulu.
Yebo ke kuyezwakala. If you can briefly summarize again in English as to what are the challenges you found out concerning COVID-19 and whether they were linked to your report or just independent.
Yeah, the challenge that we found is that when the COVID-19 hit Zimbabwe, there was just a pronouncement of level 5 staying lockdown. There were no other alternative measures to make sure that people still can earn a living, because most of the people survive by through vending, informal trading. So what has happened is that during the lockdown, the closure of the borders deprived people of those who were surviving on diaspora remittances for their livelihood, for food, for medication. Most of the people, medication is sold in US or in Rand or in Pula in Zimbabwe. So they could not get those. So it meant that they will default. And even accessing those who are HIV positive, accessing the centers for them to get their medication, it was difficult because the secret forces will. There was an incident in April 2020 where people were just beaten by soldiers in town because they couldn't. They were just carrying books, their medication books, because they don't have cards with books. So those books, the soldiers refused to read them and say, "We are illiterate, you cannot read," and they beat people. And the challenge the abuses that we're seeing, that when you are made to sit, there's no social distancing. You're just exposed, and then at times you're made to walk to the police station, or you're handcuffed together. So there's no social distancing. So these are the challenges that you are saying. Yes, we have a pandemic, we've got the limitations of rights, but that does not mean that we cease to have rights. And the other challenge that we are noticing now, despite having gone for 1 year without water from the taps, the water bills are still coming, and the City Council is demanding that. So these are the challenges that you have been on lockdown, you have had no water, and now the bills are very high. They're supposed to pay that. And the other thing we're noticing that every time when there's water shedding, whether weekly or fortnightly, when the water comes to the taps, it's at night. And at night, most women, when I'm talking about night, I'm talking about after midnight, 1 a.m., 3 a.m. Those are odd hours where, and with the current economic hardships where a lot of crime is increased, people cannot go out, risk out and fetch water. Because normally when water comes at night, that's when we start to do our laundry. These are the times to do your laundry. So we are saying City Council should need to be very conscious and gender sensitive that the people who most use water mostly are women, and they cannot risk going outdoors because most of the taps are outdoors, they're not indoors.
Very interesting. And before I go to our other guest, we saw that there's another organization, Water Action, also doing almost a similar project. Are you working with other organizations, or these are separate reports? Because they were also mentioning sexual harassment of women in these water lines.
Yes, we are aware that especially the Machiavellian Institute for Human Rights, we know that Kumbo Maposa, the coordinator there, we have shared our books with them. What we did with the report, we have shared, we realized that our issues are interlinked. So we said, so we are in a process of trying to come together and say, let us approach the duty bearers, and then we speak with one voice. But even though we did this research differently, they speak to the same, our findings are the same, which is a good thing, but we need to harness our energy and work together, and we are in the process of doing that.
Yes, very interesting. The observations from Makodonga Mahlangu, Women of Zimbabwe Arise. Over to you, Marvelous.
Thank you very much, Lester. Very interesting contribution there coming from Woza. We're hearing some of the projects that they're doing, and they seem to be dovetailing also with what we're hearing Maitendai Westerhoff talking about here, about some of the issues or challenges that women were facing during COVID-19 in the country. Ndodzoka kwamuri Mai Westerhoff kuti muchitipa mazwi enyu ekupedzisira. Tichienda mberi uko, zvii zvamungada kuona zvichiitwa nehurumende panyaya dzekubatsira madzimai nyanya anorarama neutachiwana hwe-HIV panguva ino ye-COVID-19?
Tiri kuda kuona madzimai vachiitawo access kuma-microfinancing iriko, maloni ari kupuhwa kune vamwe, kuti madzimai anorarama neutachiona vakwanisewo kurarama kuchengeta mhuri dzavo, maloni asina collateral. Toda kuona tichivadzidzisa mabasa emaoko kune avo vasingashandi muformal employment, mabasa emaoko ekuti vakwanise kuzviriritira nekuriritira mhuri dzavo. Nyaya yema-health services ngaauye kuvanhu, nyaya dze-PMTCT tinodzikurudzira zvikuru kumadzimai vanorarama neutachiona. Pavanongoziva kuti ane nhumbu chete, tinoti ngaaende kuhospital ipapo, kukliniki ipapo, abva anonyoresa kuitira kuti mwana ari kuda kuzoberekwa uyu adzivirirwe kubva muutachiona hwe-HIV, uye nokuona kuti vamai vachatakura mwana uyu vanodzivirirwawo vachiramba vaine utano hwakanaka. Saka tinoda kuona kuti nyaya maprogramu nemainterventions ekupedza umherizhonga mudzimba achisimbiswa, nokuti madzimai vakawanda vari kubatira HIV nepamusana pemhirizhonga dziri mudzimba yatinoti gender based violence, nenyaya yekupedza machild marriages mune dzimwe nzvimbo dzenyika. Vana vesikana vechidiki ava vachiri kurodzwa, vamwe vari kurodzwa, vamwe vari kuripiswa ngozi, vamwe vari kurodzwa kuvarume vanenge vaine vakadzi vakawanda. Tatoda zvirongwa zvokuti vana vachiri vechidiki ngavakurudzirwe kuti vaende kuchikoro, ngatiite masafety nets vaende kuchikoro, nokuti kana mwana akaenda kuchikoro zvinozoredusa mukana wake wokuti abatire chirwere che-HIV. Naizvozvo tinoti mishonga ngaisvike kuvanhu, madzimai ngaawane mavaccines, nhomba dzeCovid-19 dzatiri kutaura nezvadzo, ivo nemhuri dzavo, baba nevamwe vari mumhuri vawane maCovid-19 vaccines aya. Hatisati tambonzwa pachitaurwa nenyaya dzevana versus COVID-19, asi mukuziva kushoma kwandinoita, vana vadiki havabaiwi nhomba yeCovid-19. Hatisati tanyatonzwa information iyoyo ichibuda. Kasi tiri kuti vamai, vabereki vanova ndo vanhu vakuru mumhuri ngavabaiwe majekiseni eCovid-19. Isu bato redu rePan-African Women's Organization, Pan-African Positive Women's Coalition, Pan-African Positive Women's Coalition Zimbabwe, tiri very apolitical, hatiiti nyaya dzematongerwo enyika, tinotaura nezvenyaya dzakatarisana noutano hwamadzimai. Saka tiripo pakubatsira madzimai kuti vararame neHIV vachive neutano hwakanaka, nokuvakurudzira kuita mabasa emaoko, nokuvakurudzira kupita.
We're hearing there from Tendai Westerhoff speaking about some of some of the issues that her organization is handling, and she says the organization is not political, it's apolitical. So she says their role is to give awareness to women living with HIV. But unfortunately, her network didn't continue, so we couldn't hear her. But for those that are just joining us, I think we're actually coming to the end of our program. I'm just waiting for my co-host Star kuti ndienderere mberi nchitini. Aiwa, apo tanga tiri kunzwa kubva kuna amai Tendai Westerhoff vanorarama ivo nedenda reHIV, asi vari kutaura kuti vanhu ngavabaiwe nhomba yeCovid-19, uye vachitaura ivo kuti sangano ravanoshandira isangano risina kwarakarerekera, rinongoita chete zvokutaura nenyaya dzekuti madzimai vanorarama neCovid-19 neHIV vangaite sei panguva ino yedenda reCovid-19. Star.
Yebo ke, marvelous. Lapho besizwa ke unkosikazi Tendai Westerhoff yenothi uphila legcikwane lengculaza, esichasisela ke ukuthi abantu benze njani ukuvikela leli gcikwane. Sesibuya kuwe njalo Nkosazana Mahlangu, if you can explain to us as we are talking now, what's the situation like concerning water? What is the situation like in the townships? We understand it's better. Is this what you are seeing?
Yes, it's better for those that are in the low-lying areas, but those that are in the high-lying areas, they are not still don't have water. I think they are in their 18th month now. For instance, I will talk about the Makweke Reservoir, where we are looking at the houses that are direct adjacent to the reservoir. Those people are not getting water, and those are the people who are still going to boreholes. Those are people who are still coming to low-lying areas and getting water. And for the challenge now is that the billing system doesn't factor in that I'm assisting my fellow resident with water, so the bill gets high. But there's no way as a human being that I can deny someone getting water. We are still giving out that water, which is another thing that we need to lobby the council on.
Yebo, kuyezwakala ungasichasisela njalo ngesindebele ukuthi sikhuluma kanje, kuyini okwenzakalayo lapho ezibhoraneni.
Okwenzakalayo kathesi ukuthi amanzi thina abalaba esihlala endaweni eziphansi atholakala lapho kuqanse khona katholakala anjengama-flats nama-flats katholi manzi, bese sinanzela futhi khona ukuthi khona singakhangela isigxingi samanzi esikuthi amanzi semagodolo esesinika abantu kulezi ndlu ezikhangelene khompana vele eze-salvation ezikhangelene khompana directly lesigxingi samanzi abatholi manzi laba bantu ngoba i-pressure ivele i-low. So laba bantu ngumakhelwane bethu ngesibancisha amanzi basuka ke khona ngale bazocela kithi amanzi kumbe bayilayinini esibhoraneni kulokho kulohlupho lokuthi kulabantu abalima khona abalimayo bayofuna ukuthelela ukuze bathole ukuziphilisa ngoba basiphilisa khonapho, so kuyadala ingxabano khona. So khona ngathi ngifuna ukuthi khona amanzi angeke ngiwancitshe umakhelwane engelawo, siyabanika kodwa ibhili yamanzi ibuya iqansile ngokunye kuzamexoxane lakho sibonisane lo sithi council ukuthi kathi njengoba kulezi ndlu ezingaphuma amanzi sebesiya kumnyaka wesibili lawo lezi ndlu ezingaphuma amanzi, kodwa siyabanika lawo manzi inhlawulo zangikhona kumele liwuphathe libone ukuthi no ngoba nxa ngiziphumakhelwane ongaphumelwanga amanzi ngisebenza umlando ka-city council. So uhulumende le-city council kumele babone ukuthi bakuphatha njani usizo lwami i-community service enyenzayo.
Yebo-ke siyabonga. Your last word-ke ngamafitshane.
I would like to ask the authorities, especially the central government, that they need to really understand, because the Bulawayo City Council have been talking about the water crisis, and the local government minister declined to declare the water crisis in Bulawayo. Apparently, it was going to affect investments, but we are saying they should not prioritize investment at the expense of lives, because water is a necessity, water is a need, and the water crises are really tormenting women. We are going to unknown places. We are really resorting to undignified ways of trying to earn a living, to survive, because we don't have water. And it is unfortunate that most women in the report, they were saying that they were reprimanding their children for drinking water instead of encouraging them, which is really inhumane. So we need water. We need raw water so that council can give us potable water in our from our taps.
Yes, a strong closing there from one of our guests, Makoto Mamashango of Women of Zimbabwe Rise, coming to the end of our show. I'm your host, Sithandekile Mhlanga, until we meet again.
And I'm Marvelous Mhlanga Nyahuye, broadcasting from my home in Washington, D.C. Let's meet again on Let's Talk Ngati Kurkurei.